Hey guys, we're here with Deb Johnson, the CEO of St. Clair County Community Mental Health.
We have a play that we do every year. In fact, it's coming up in November, Home for the Holidays, actually written by folks with mental health issues along with one of our staff that assisted them in writing the stories. And the actors in the play are people who receive services, people who provide services, and just general community members who like acting.
I'm Jim Hudgens. I'm the executive director at New Pass in Flint, Michigan. So New Pass is a full-service substance use disorder program in Flint, Michigan. We service anybody in need that has a substance use disorder. We can start you in our social detox, what we refer to as our sober house, and then hand you off into services with our recovery coaches, get you into recovery housing if needed, and if you need residential treatment or if you need medicated assisted treatment, we can do that. It's about finding the person where they need to be today and where they want to be and helping them get there.
My name is Eric Kurtz. I'm the CEO of the Northern Michigan Regional Entity, which is a behavioral health and substance use disorder prepaid inpatient health plan for the nowhere lower part of Michigan. Well, Region 2 is the Northern Michigan Regional Entity. We span 21 counties, 11,000 square miles in the northern lower Michigan, which goes from the bridge all the way down to Manistee, Benzie over to Alpena.
Hey, this is Sean Jordan. I'm sitting here with my new friend Bonnie from Protocol, right?
Yes.
And you guys have a new product across here called WellTrack.
Yeah, well, yep. So WellTrack is our whole suite of services. WellTrack by
For
Protocol.
behavioral health?
Yes,
Okay.
yep. We offer our Help Now, which is our crisis services, so it's over the phone. And we offer WellTrack Boost, which is our CBT-based self-help app. And we offer WellTrack Connect, which is our global referral service. And then we also have managed care and through our guide services.
My name is Andre Johnson. I have a PhD in clinical psychology. I'm the president and chief executive officer of Detroit Recovery Project, which is a 501c3 nonprofit organization. We provide comprehensive behavioral health and physical health services to individuals that reside in the city of Detroit.
I am Jennifer Tackett. I'm the art therapist at Meridian Health Services. Working with clients, I run group art therapy, both at the men's facility as well as the women's facility, as well as a healing trauma group at the women's facility. We also offer individual art therapy sessions, so if clients find out that they're having a hard time connecting to what's going on in their head and their heart, in a more nonverbal way, the art therapy process allows them to kind of find their voice again.
Well, I'm here because I serve on the board of directors of the subcommittee for the Detroit Wayne Integrated Health Network, but I'm here to learn more about some of the resources and opportunities that's impacting those who are struggling with substance use disorder and mental health disorders.
Hi, I'm Sabrina Sassine. I am a peer recovery coach for Meridian Health Services, and I work on 5 judges sober courts in Oakland County. Several years back, I was an Oakland County drug court graduate, their adult treatment court program. And so after I graduated that program and stayed sober a couple of years, I ran into someone at a training and they kind of told this guy that I was into peer recovery coaching. And so through Briggs and the court system, I came to work for Meridian Health Services, and then I was hired onto the court teams.
St. Clair County, we serve about 6,000 people a year. Those are individuals with mental illness, substance use disorder, adults and children with intellectual and developmental disabilities, through a whole range of services, ranging from least intensive traditional outpatient services to residential treatment programs and everything in between. We are also a CCBHC, so that has tremendously expanded access in our community, because now we accept people with mild to moderate mental health conditions and people with private insurances. So we have really been breaking down the barriers to access, and that's why we're seeing a huge increase in the people we serve.
As a person who have experience in this life, person who was condemned to life without the possibility of parole and was able to get back out and be able to see so many people addicted and afflicted, and those who don't have the education or the knowledge to be able to take those skills to those who are hurting, this is vitally important.
Doing some amazing work, working with people who are less fortunate in some cases, some people who didn't have a chance, how they were born with mental health challenges. Some people have had, trauma, needs a lot of professional help and support, and that's what we want to show up for. We want to improve our system, and we want to make a difference in our community and in the great state of Michigan.
What I have found in the process of being a therapist is being able to really start connecting with an individual through telling their story and starting that healing process. And something that's really cool with working at Meridian is that they have peer recovery coaches. So I worked with Sabrina in her healing journey at the beginning, and she was able to kind of continue her journey and then come back to Meridian to work as a peer recovery coach. So it's kind of cool to have that full circle, to see her on that journey and to see her success.
My first day at Meridian, when I was kind of being introduced to, the different departments in the unit and everything, and I ran into Jen and she came up to me and gave me a hug, and she was the first person to recognize me, as I had been a client about 4 or 5 years prior to when I started. And she was so excited to see the full circle, and I was so excited to be able to see her, because she was one of my favorite therapists. Even though I am not artistic and fought tooth and nail, she showed me how to work with my hands to kind of work things out and let my brain settle. And I still to this day have the little clay dog that I made that was after my very favorite and special dog at home.
Well, 2023, we will continue the expansion of our opioid health homes. We do have more that are on platform this way. We just had our day of education more than 30 days ago or so, which was a total focus on recovery efforts within our region. Peer supports was very well attended, and we had a lot of representations from our substance use disorder community.
I would be remiss if I didn't say thank you, Sean, for your leadership. I know I've met Sean several years ago, and he's always had a heart to work in this space, to bring talent in this space, and to bring innovation in this space. So we appreciate your partnerships, your efforts, and all that you do.